A 60-year-old woman with past medical history of hypertension, hyperlipidemia comes due to abdominal pain after eating for the last few months, and also states that she has lost weight unintentionally. Exam shows minimal tenderness. What is the cause? So for this patient, you're going to have the answer choices of A, atrial fibrillation, B, atherosclerosis, C, fibromuscular dysplasia, and D, trauma. So I'll let you answer the question, and then I'll explain in 5 seconds. Okay, so the answer is going to be B, atherosclerosis. So for this one, we have a patient that's presenting with chronic mesenteric ischemia. So the cause of this is atherosclerosis, which is the accumulation of lipids on the arterial walls. And so just like normal plumbing, if you have part of the wall being covered, it's going to decrease the amount of flow through that tube. And so since this is occurring in the arteries that supply the intestines, the patient will have pain after eating, since when you eat, you need increased blood flow to the intestines to help with processing all that food. So this is a very similar to cardiac ischemia, where essentially when you have atherosclerosis of the coronary arteries, you're going to get ischemia when you're exercising, because now suddenly you need more blood there, and your coronary arteries simply cannot supply it since there's an obstruction. And so it's very similar to that in the fact that you still get pain after exertion in this case, which is going to be eating food. And classically, the patient is going to be in severe pain. However, when you check on exam, you're going to have minimal tenderness. And so this is the classic pain out of proportion response for patients with chronic mesenteric ischemia. Now the other answer choices, it's going to be atrial fibrillation. So this one can actually cause acute mesenteric ischemia, and this is typically caused by a clot that is formed and then it embolizes. So when it embolizes, it just means that it moves somewhere else from the original location, which for atrial fibrillation would start in the heart, usually in the left appendage, but then it would embolize to a different location. And then for the next one, fibromuscular dysplasia, it doesn't involve atherosclerosis. It's usually involving the renal arteries, and it causes constriction of the vessels, but not due to atherosclerosis. And the final answer choice, this patient actually presented with a gradual presentation versus if you had a patient come in with 1 day history of this abdominal pain, you would think and have trauma on your differential, it would be a little bit higher on your differential, since that's something you want to take into consideration. So for this one, it's the classic case of a elderly patient coming in with risk factors like hypertension, hyperlipidemia for atherosclerosis, and having severe pain, but minimal pain on exam. And the fact that she's lost weight unintentionally is one of the other things, since the person's going to naturally associate eating with pain, they're going to eat less, and so therefore they're going to lose weight that way. So I hope that helped, and thanks for watching.